Bismillah ar-Rahman ar-Rahim. Very welcome, ladies and gentlemen. This is Muazzam Ali Sandhu, and you are listening and watching Your Voice with Muazzam Ali Sandhu. This is our weekly show wherein we discuss different kind of the current situations, scenarios, current affairs, and as well as the public interest issues which do concerns to the local communities, which do concerns with the public at large, whether or not it's related to individual, organizational, or collective society. So, ladies and gentlemen, today, as you all aware, that the United Kingdom has announced another national lockdown for 1 month. Gladly, we have a very important guest today. She is the councillor in the Waltham Forest, London Borough Council, Waltham Forest, and she is the cabinet member for the health and poverty reductions. So I would like to introduce Cllr Naheed Asghar. She's present in our show. Assalamu alaikum, Ms. Naheed. Welcome to our show.
Walaikum salam, Mr. Sandhu, for inviting me today.
Thank you very much, Ms. Naheed. We are very much aware, as you already told me, you have a very big, busy day ahead, as well as because tomorrow the national lockdown is going ahead. So you need to do a lot of things. And I extend my thanks to you to giving us your precious time. Without wasting time, I want to start asking and start the discussions about this national lockdown because the people since March, throughout the year 2020, people have been facing so many difficulties, so many problems. It is not for a particular group. It is for every single person who is living apart in this world, apart from he's from Europe, Asia, America, South America, wherever they're from, to even Africa or Arab countries. Every single individual of this world has been affected due to this COVID-19. And the UK, particularly, is one of the biggest champion to dealing with the COVID-19. But sadly, recently we crossed over 1 million cases in UK, that is highly alarming. That is questionable, as well as sad situations, and we lost the lives of the UK citizens, which is cost more than 43,000. These figures increase the concerns of the ordinary person, that what is happening. If we are living in the developed countries, so many underdeveloping countries, they had coped up with the COVID-19 situations, like such as I refer to the Pakistan, where the people are now living their normal lives, and the country was gone into very short lockdown period. But whereas compared to the United Kingdom, we are living here, and there is another lockdown. What's your comment?
So yeah, it's strange times for all of us. We've all lost friends, family to the disease, to COVID-19. I suppose one of the roles that we have to play as a local authority is, there's government guidance coming out on Thursday again, and one of the important roles we have to play is conveying or sifting through a lot of that information that can sometimes be difficult for vulnerable residents or people that are unable to understand it, to sift through that information and figure out what's important or vital or relevant for our residents, and convert that information and pass that information on. It is quite sad. I mean, worldwide, you'd think that countries like Pakistan and India would do worse than us, but in fact, the developed countries like ourselves and the US and other European countries have performed quite badly in terms of case numbers and sadly deaths as well.
That's correct.
Extremely high. So it's quite strange. I've still not understood that, and I think people around the world are still trying to figure out. The scientists and the medics are still trying to figure out what's happened. And I mean, I think there's been sort of phases throughout the through the pandemic where things like we were encouraged to go out and spend and eat out to help out, things like that. With the relaxation of those rules, somehow then, you know, triggered more of the disease to spread, and we are here now.
That is very correct. I agree with you because when the decisions about the eat out, help out was taken, so many people criticized it. And again, for example, in today's announcement, which we are going to take practically lockdown from tomorrow after a certain time, midnight, the country still have so many concerns, so many issues about this lockdown because few groups of the people are relaxed, and the few groups of people are not allowed to go outside or open their shops or businesses, and they are not allowed to meet up with the peoples. There are still same mistakes the central government is going to take. I think, for example, they are they are asking all the non-essential businesses to shut down. However, they're still asking the schools to remain open. So the virus, do you think the virus is very generous with the kids and the teachers not to go close to them?
That's one of the key differences. You know, the educational establishments this time round are being advised to stay open because of the impact on education and the impact on mental health of those children. I mean, you know, that the effects of which we might see many years later. In terms of Waltham Forest, as of last week, our situation is that we were at 440 cases, and when you equate that to 100,000, that's 158.5 per 100,000 people in the community. Our rates are lower than Northeast London neighbouring boroughs, but we're still slightly higher than the rest of London. And deaths from COVID-19 in the borough are still quite low, thankfully. But I mean, last week we had 3 deaths in the borough, but we are sadly, unfortunately, expecting that figure to rise.
All right. Okay. So thank you for giving us the current situation of coronavirus in the Waltham Forest. I want to take you further ahead in terms of dealing with this virus. Uh, can you please tell us the and our listeners that what Waltham Forest providing support, how they're giving any guidelines and making sure that every single resident of the borough is well aware what are the restrictions in place, regardless the people's language barrier, cultural barrier. For example, recently the big concerns from the BAM community has been raised. Why the BAM community has the high rates in the infected coronavirus people?
So, yeah, I mean, the guidance for everybody is the same, whether you're from Black, Asian, minority ethnic groups. The key messages are that residents, everybody follows the 3 important steps to keeping themselves and their family and members of the community safe. And you've all heard this on the NHS communications that have come out and from the government, is to obviously regularly wash your hands with soap and hot water, to cover your face with a mask when you're in an indoor setting, and also then to keep a reasonable, sensible distance between yourself and the other person. The coming winter, we know, will be difficult for many of our residents, but we're trying to work together to stop the spread of the virus so that we can keep each other safe. And we're asking residents to follow guidelines to keep each other safe and listen to the NHS test and trace staff if they do ask you to self-isolate. In addition to that, we're distributing 30,000 face masks to residents and council staff as part of our ongoing work to support the community.
That's
And
great.
this includes giving face masks to religious groups across the borough, so then they can then be given out to their congregations to who can then worship safely. Our teams from the council have been out and providing information and advice on at places like train stations about how to stay safe while observing social distance guidelines. This has also been translated into the top 5 most spoken languages beside English, so that everybody is able to understand what the restrictions are and what it means for them. At this point, I also want to thank emergency services who have gone above and beyond and put themselves at risk, who are working extremely hard to keep us safe. And people that are not often mentioned are people like the refuse collectors, who also work very hard and put themselves at risk and continue to put in extra effort to keep our neighbourhoods tidy, as well as residents and businesses, small businesses who are volunteering to support those in most need at the moment.
In terms of the businesses, if you say the small businesses, I know that there was some procedure in place and a criteria the government introduced how the local authority provide the support to the businesses according to their business rates. But there are still so many businesses that do not have the business rates. What support the Waltham Forest providing to those businesses?
So in terms of our businesses, we've we've got like in terms of our finances, and then I'll talk you through the furlough scheme and the jobs. We've had an emergency support put in place that has led to our own budget of 38 million. We
Right.
received we received 18 million pounds in financial support from the government, and that's enabled us to keep services running, but still leaves a gap of 20 million, which we're trying to tackle and now identify some savings and looking to our wider budgets and changing programs of work. We've also received just over 2 million to support residents' council tax bills,
Right.
and those in need receiving up to about 150 per council tax support recipient. So, and in terms of the businesses, we've worked really, really hard with them and for them. We've paid out just under 45.5 million in grants to local businesses to support them, and that money has been distributed to every business that was eligible. And we're one of the few boroughs that proactively booked hotel rooms for rough sleepers and paid, because at the time we were told by the government that we will be reimbursed for that cost, which was about £125,000. And like other councils across the country, demand for our services has increased beyond recognition, whilst our income from fees and charges has dropped significantly, like charges that would be generated from parking, from libraries, leisure centres. So we're not seeing any of that income stream now, and we've had to discharge hundreds of vulnerable people from hospital, but not just discharge them and leave them to it. We've had to provide them with the care that they need. There's vulnerable children and families that have needed more help, and we've had to make a significant financial contribution to London's additional mortuary provision. And then we also stepped up and worked with residents to work as a community to support each other through the crisis. And now we really, really need the government to give us certainty on the future funding so we can continue to protect each member of the community, because uncertainty at this time in funding makes it really, really hard for any local authority to plan for the future. In terms of the furlough scheme and jobs, Waltham Forest residents were hit probably the hardest in London. At the peak of the first lockdown, 38,000 of our residents were furloughed, and that is one of the highest figures in London. So we've seen a five-fold increase in the number of residents contacting us asking for financial support. And at the height of the first lockdown, nearly half of our residents were either on furlough or being supported by some form of government funding.
Right. Thank you very much. You gave very articulated and detailed information about what financial support the local authority Waltham Forest is providing. Although your role is dealing with the health and mental health and the poverty reductions, but I'm very glad you covered so many things. And I must say that the local appreciate the role you are playing and your borough the in this unprecedented time, in this difficult time, the people really looking towards the local authority to come forward and play a role as a shelter, as a mother, as a carer, who do have concerns about the people's hardships, the difficulties that every single member of the community is facing. And yes, if this kind of the support is not available, even regardless the support is still there, but because as you mentioned the central government, the borough is also depending on some points central government's funding as well. Due to the shortage of that funding, the people still facing so many depression, stress, because of lack of much facilities, much support. They have gone through with the mental health issues. As you are the member of cabinet member who deal with the mental health issues as well, I will cover with that point later on. Before that, I want you to can you tell us and our listeners, if for example any member of society and community living in the Waltham Forest, how they can get the facility of testing the coronavirus. And some people they do have given some advice and directions from the GP, from NHS, from their employer or anyone, other authorities. And also some people wanted to travel out of the country and they do need the test certificates, the positive coronavirus test before they can make a travel plan.
Yep. So in terms of our borough, Waltham Forest, we've got three testing centres. The two walk-in centres are at Stanley Road, which is just off Lee Bridge Road, and then Linford Road, which is nearby Forest Road, and then the drive-through centre is located at Oliver Road. That's close to Leighton Orient Football Ground. There's also drive-through centres in Greenwich, Lee Valley Sports Centre, and other sites around London. But those three are the ones that serve our residents.
Yeah, hang on. When you say drive-through center and walk-in center, what does it mean? People can go without appointment?
There are two options. I mean, we'd advise people to make make an appointment, but the walk-in centre does have provision for people who turn up unexpectedly. But we still encourage them to
Do
make the
some
appointment,
appointment.
so somebody is aware that you're going to attend. And then you can also order the home test kit by visiting the NHS website or calling 119. But if you do have any symptoms like the cough, like the
Yeah.
fever, loss of smell or taste, then we advise that, and everybody, NHS advise this, that you book the test immediately, because that's the only way we know for certain that you have the disease and we can tackle it. And whilst you're waiting for the appointment, whether it's the one day away or a few days away, please self-isolate until you're able to book the test, or to call, or you're unable to, by the time you call NHS or 119, just self-isolate during that time. And also avoid using public transport to travel to any of the test centres and anywhere in the country. So
For the benefit of the listener, can you repeat these three signs which you said? The loss of smell and what others?
so
Uh,
that the loss of smell or taste,
yeah.
a persistent cough, and a fever. And it doesn't have to be all. It could be one or two or more. And there are many cases where people have shown no symptoms but have obviously tested positive. We're also asking that until you receive the test results, however many days that is, it's usually 2 to 3 days, you still continue to self-isolate. And if you're asked to self-isolate by the test and trace workers, and they contact you, please listen to them. They're working for your benefit. They're trying their
Yeah.
best are safe. And our test and trace workers are being supported by local the test and trace workers are being supported on local level as well by our contact tracers, who have more insight and more detailed local knowledge of the residents in Waltham Forest. Please don't leave home. I mean, it is very tempting when you think that you need essential items like groceries and so on, but please ask your friends, neighbours, family to help you with those things. I mean, in the last 7 days up to 22nd of October, we had just over 13,000 tests per 100,000 population in Waltham Forest, and that's similar to the London average. And in terms of the council also working with its partners, we've run lots of regular exercises testing the local response to hypothetical outbreaks in settings such as care homes and schools, and that work has taken place cross-border as well. We've worked with Redbridge as well, and it's proved quite successful and helped us understand where gaps are.
Right. Please do listen to the health guidelines and the test and trace workers, their guidelines, and the local authorities' restrictions and guidance and instructions. It is very important not only for you, for your beloved ones, for the people who are working with you, for your neighbors and your fellow member of the community and society. These things are very important for the to coping up with the COVID-19 crisis. Otherwise, we have to carry on with the one circle on and on. Then I was listening yesterday the LBC wherein it was saying that if the things will not get better in this lockdown, maybe the country will design kind of the tier four and tier five system. Then they can have on and off lockdowns in with the passage of time in terms of in order to get full control to spread the virus. Do you aware of that?
Yeah, I am. I mean, I think this is something that's here to stay long term. I mean, even the date that we've been given, 2nd of September, it could be extended if numbers and the infection rate isn't controlled and death
Yeah.
numbers continue to rise. So I wouldn't be surprised if on the 2nd of December or before that we're told that it's going to be extended in for a month, another month or so, or a few more weeks.
Oh
And
my God. So, Miss Nahid, do you aware that the people, because I normally remain in contact with the all of the my friends, fellows, colleagues, people working in the community in different type of activities and social activities and issues. Every single person, he is unhappy. They said then they complained that their independence has been snatched, or they're trapped in kind of the live the limited activities, the limited scenarios. They cannot visit their beloved ones. They cannot have the parties, events in their home, garden, barbecue parties, and they are not happy with that. And end of the day, they were thinking that okay, after this summer, we are having towards a free a free lifestyle again. But this lockdown gave a very horrific and sad message. People are again disappointed. What is your comment?
definitely. I mean, I'm disappointed as well. I was disappointed the first time round, and on a personal level, my daughter wasn't able to do any of the end of year activities, prom, the celebrations that you'd have following your A level results. So it has been difficult for everybody. And then as a parent, trying to support your child to get through that difficult phase, it's even worse for families that are more vulnerable or more financially in a worse situation. In
Correct.
terms of addressing some things, I mean, we can't obviously arrange barbecues for residents, but
Yeah.
we've tried certain things where we've try to address mental health issues and the well-being of residents in lockdown. We've put on a range of virtual activities to help keep families entertained and active, and support services for those in need. We have the 5 Ways to Wellbeing campaign, and that was adapted to encourage people to engage in 5 proven ways to improve their mental well-being, including connecting with others in a safe way,
Right.
sometimes online, remaining physically active, and then using what we now have a lot of is spare time at home to learn new skills. And many of those activities are targeted to children who find lockdown really, really hard. And we're providing active digital activities such as story time sessions with our libraries team for young children and parents. There's something called chit chat, chatter pat sessions to develop language skills for children under 5. And Waltham Forest Council offer library services online, meaning that you can access digital library resources from your own home. You can
That's
have to, yeah, it's really, really good. Residents can have access to newspapers, magazines, ebooks, and audiobooks. And we're also running a book delivery service during the pandemic. Partners in the NHS have also worked hard to move services such as talking therapies online so that residents can continue to access support during the pandemic. We've also collated information and sources of bereavement support for residents who sadly might have lost loved ones during this difficult time. And our volunteers have been absolutely amazing in providing support to isolated or vulnerable people who live on their own or have been forced to live on their own during the peak of the first lockdown. And sometimes just having that meaningful contact, somebody to speak to for a few minutes, just to even just touch base with, just talk about your day, is really invaluable for some of these residents, because that might be the only bit of contact that they will have. And we've also hosted virtual cultural activities over the summer. So normally every year, I'm sure you've attended the Waltham Forest Mela. Obviously that wasn't able to take place, but we've had fitness and physical activities in place for people of all ages. And that you can get more detail around all these resources from the council's website on walthamforest.gov.uk.
That is amazing. I'm really glad to know that the local authority is really giving the great support in terms of making people busy, to engage people in the productive and creative activities instead of the non-productive activities. So these are all the things which are important for a healthy mental health and a healthy person, to support that person's not to go in any trauma and stress or depression during this crisis, during this unprecedented and difficult times. I'm really glad to know, Ms. Naheed, as you are the lead in mental health. There are so many people I know that they are suffering with the mental health issue. They have the problems, mental health issues, and gladly the government and local authorities has designated authorities as well as departments who are dealing with this. Before, with compared to a few decades before, the mental health disease was not even recognized. It wasn't given that importance, which at this time the local authority and the governments giving the importance to the mental health. These are important things, and I'm just heading towards a very short break. And after the break, I want you to give a little bit light on the mental health. Then we will discuss about the children's their safety risk assessment and the school, why the children's are still going to school in the lockdown. Someone was saying on the social media, they were saying that the government has the biggest enemy at the moment, which are the children. They are not liking the government, why they are not closing the school for them when they are closing the rest of the country. So, ladies and gentlemen, please stay tuned. We are heading towards very short break, and we'll be right back.
As winter approaches, here's a critical reminder of coronavirus symptoms from Dr. Gupta.
The main symptoms of coronavirus are a high temperature or a new continuous cough or a sudden loss or change in your sense of smell or taste. If you have any of these, to protect yourself and others, it is critical you isolate at home, even if you don't feel too bad. And you must book a test immediately. Use the NHS COVID-19 app or go to gov.uk/coronavirus.
Stay alert, control the virus, save lives.
Thinking about selling or letting your home? With Maxwell Estates, you don't need to look any further. Well established with over 15 years of experience, Maxwell Estates are specialists in residential sales and lettings. We manage over 200 properties in and around Northwest London, keeping our landlords and tenants updated with all the latest laws and legislations. Based in Edgware, our experienced specialist negotiators always ensure we maximize the full potential of your property. Call us now on 0208 952 0808 for a free no obligation quotation, or visit our website www.maxwellestates.co.uk for further information. Maxwell Estates, the name you can trust.
Revive FM
94.0 on the radio,
on your mobile,
and online.
Welcome back, ladies and gentlemen. We are having our guest, Cllr Naheed Asghar, the cabinet member from London Borough of Waltham Forest. Ms. Naheed, I want to ask you the question. I think many people do have the same question. The mental health has a lot of grown in this country. The problems of mental health, the crisis of mental health, and the normal GP practices, they are not dealing with it. They do have further recommendations and reference. They do refer the mental health patients to the mental health department instead of dealing with them, which do trigger further or do have a lot of importance in terms of to giving them full support medically, or especially the support which you gave us before, like healthy activities, giving the productive and creative facilities, spending a lot of time in the sports or other community members, wherein they will have a full support. Can you please give us little bit things about that? So as during this lockdown, the mental health issues, I think 500 times increased because of the difficulties of the people. What are the causes of mental health? Why people goes to mental health issues?
Not being a clinician or any kind of sort of expert in this, but various reasons, you know.
You can just share that support available from the local authority and from the GP practices.
So I think in the first instance, when you do visit your GP, they may not make that sort of medical referral. They will, try and put you in touch with local, based on an initial assessment. Sometimes GP will see if there is support available in the community. Then they will signpost those. So we have local area coordinators who work with the individual. That could be things like helping them access work skills, life skills, or putting them in touch with groups that are outside of the medical setting to combat some of the problems that they're facing. For example, in Leighton Orient Football Ground, there are sessions for people, you know, that encourage more physical exercise, that encourage more socializing, and we also have the befriending service, which is kind of like a one-to-one service. Again, that offers the same kind of guidance, but some people will not perform well in larger group settings and will benefit more from those kind of services. But in terms of the reasons vary from things like trauma, childhood trauma, bereavement, family breakdowns, loss of a loved one. There's countless reasons why people have mental health issues. in terms of our BAME residents, who are the main listeners of your show, they've also been affected quite badly. We know that, you know, as a community, we like to visit each other's homes a lot more, and
Yeah,
we like to socialize with different generations of our families, and which isn't possible now, especially if you're not living with them. And
yeah,
yeah, so most of those residents have been affected because of the disease and the impact that it's had on the mental health of those people.
but
Would
do
you
you,
like me to? Yeah.
but the council says that at this time, do not visit your relatives, do not go to anyone's house, do not mix with other household peoples. And do you think these restrictions increasing the mental health problem, because some people, they do depend on someone's emotionally, they need the support of their beloved one, their mother, father, brother, sister, anyone. uh, I mean, anyone can play a vital role in someone's life.
Yeah, I mean, there's ways around it. You know, with technology being as it is now, there's so many ways where we can keep in touch. But yes, people do miss out on that element. You know, having that social interaction with their children or grandchildren or extended family. But there is still that, you know, the bubble where you can mix with one other household, and also if you're mixing, limit that to six members at the moment.
Yeah. Ms. Naheed, as I know that you're very busy, we cut the little time short as well, because I'm not taking the commercial breaks. It will go end of the show, all of that. I want to get the maximum benefit of your presence in my show. Let's talk about the children. The schools are open in lockdown. The virus, do you think it will not go close near to the teachers, to the parents who are taking their children to school and taking back, and children themselves?
I'd obviously, you know, children and schools are not immune to it, but ideally, I think that there's two sides to this coin. Whether if you keep the schools closed, we've already had, you know, children missing out on 6 months of learning,
Yeah.
and the impact of which we might see next year, 5 years time, or a lot later. It's going to affect their life chances, their life choices, hard working throughout the period to keep the schools safe and reopen all of our schools in September. As a council, we've got special contact for schools and other settings in the borough available 7 days a week in the event of a case or an outbreak, so that they can then share advice and guidance. We're also working closely to
But
ensure that.
Ms. Naheed, Ms. Naheed, before the lockdown, during the lockdown, the first lockdown, children do have the facility to carry on their learning process while they are at home through the technology, through internet. Teachers were giving the lessons through internet. So, do you think, and the same system is in place in America as well, and some other countries? Do you think this is not the replacement of school?
You've got to remember that not every household with more than one child, or, you know, several children, they're not able to provide that level of digital support for their child to have that learning or that remote learning when they're not in school. And alongside with that, there are added benefits of the child being in school, you know, having that sort of that peer support, that interaction with your children, with your teacher, with other children, with other support staff. So it kind of benefits them on a mental health level as well. We're providing messaging and to parents via schools with guidance and advice and reassurance in event of a case or an outbreak. And, we're providing face masks. But in an ideal, yes, we probably would like to see, every child have their own laptop or iPad to access online support, but it's not
How they
possible
will
at
have it? How they will have
the
it? The local authority is able to provide it?
at the moment, as I discussed, like with the finances where we are, we're not able to make that provision on that scale. But at the moment, we're asking government to do more. Our education settings need access to the same, COVID testing capacity that's available to NHS staff and patients. And then we also want more funding to cover the additional cost of keeping the schools open in their current format for example, cleaning products, protective equipment, and cover staff who are isolating or ill. And there needs to be more adequate funding for remote learning, and that includes laptops and remote connections. And our leadership is lobbying the government to provide more of those vital resources. And in terms of the school
Yeah,
meals as well,
I think that
you
is
know,
the
we
most important thing. Yeah.
yeah, I mean, we want the government to fund free school meals during the school holidays completely. In terms of the Waltham Forest offer, we'll be developing a wraparound support offer over Christmas holidays and continue to work with our amazing community organisations like Plate for You and so on, and the Children Family Centre and schools to support those families. Um, there's
Ms.
measures
Naheed,
that
Ms. Naheed, the laws which relates to the children, the Section 55, the laws very clearly dictates that the Secretary of State is responsible for the children's welfare. The Secretary of State is responsible for the children's safety and care. During this lockdown, whether or not children goes to school or stay at home, uh, as you already highlighted, not attending the school may affect the children's mental health, may affect the children's education, which directly relate to their welfare, which directly relates to their basic fundamental right and interest of their care. So I think that this is a critical situation if the government is unable to provide the support, the technology equipments to the school and the children. These things are questionable. And as a local authority, if you says that the local authority doesn't have the funding and support from the central government, so I believe the local authority's primary duty is to get that funding from the central government. Do you agree with that?
that's what the role of local politicians is, and senior politicians is to lobby central government. I know the councillor, the lead member for children and children's services, Grace Williams, has expressed her concerns as well in writing, and to raise concerns around lack of funding for elements where the school remains open, and where if the schools had to close, and the support that the local authority would need and the children and those families would need in order to carry on functioning, being able to participate in remote learning as well.
And do you think, due to a lot of concerns of the people, as a school governor, I know that a lot of parents contacted me. They raised concerns in terms of during the lockdown, the children's safety and welfare. So, do you think the during the lockdown, the schools may go to close as well because remaining school open still raise a risk for the whole community, because everybody who has the children, school children, they go to school along with the children as well. So the lockdown mean to stop the spread of virus. So if we on one window we are keep opening and the rest of the windows we are keep closing, the virus still coming in.
I think time will tell. It's probably a bit too soon for me for me to sort of say anything either way. But I mean, as a local authority, we have to follow guidance from central government. I mean, if they do on Thursday or at any point between Thursday and the 2nd of December say schools have to close, we will do what is needed to support those schools to remain open or close. At the moment, for us as a local authority, it's important that schools are properly supported to prevent infections and to manage incidents when they arise. Because as infections rise in the community, like you said, schools are going to experience a rise in cases too. So it's important that we do everything to keep the children and staff safe in schools and any learning setting, whether it's colleges or and childminders and nurseries. But we'll continue to support schools. We'll work with public health to make sure that
I'm glad. I'm glad to hear that you are continuing supporting schools, teachers, children's in order to protect their welfare and health during this unprecedented time. Ladies and gentlemen, we are heading towards the end of our show. Miss Naheed, I want you to give 30-second brief message to your local residents, to the member of the community of Waltham Forest, what you want them to follow the guidance.
The guidance is the same as what I've said before. Please, just adhere to the guidance that is given by NHS England. Wash your hands regularly, wear your face mask, maintain that social distance. Nobody is immune to it, in particularly people, with underlying health issues, and many of our BAME residents suffer from underlying health issues, so we're more at risk. I think we've got through a difficult phase. We were in lockdown for several months. This is what has been proposed till the 2nd of December is less than a month. It can't be that hard. Rely on your friends, families, neighbours. If you have to, just avoid going out. If you show symptoms, avoid going out at all. Work from home where possible, and access support that is out there. Do your research. There's lots of support available in Waltham Forest, in Newham, on all London boroughs, and ask people to guide you. That's what the council's there for. Please stay safe, keep your neighbours safe, and look out for everybody. Thank you.
Thank you very much. Please stay safe, look after everybody, and maintain the social distance. These are the punchlines of the local authority. These are the punchlines of our today's guest, Miss Naheed Asghar. She is brilliantly working hard towards the betterment of the society and community, and we really appreciate your effort, Miss Naheed. This is really end of our show, and hopefully we will have another time. We will come again and welcome you again to join us to cover up different other issues and topics in relations to your lead. Thank you very much, Ms. Naheed. So, ladies and gentlemen, please keep listening and watching Revive FM 94.0, and hopefully you have got a lot of good messages and productive informations during this show. Thank you so much.
Thank you.
Thank you.
The views expressed